Hello, my name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Thank you for joining me to talk a little about speech therapy for adults. Many people don't realize that adults can receive speech therapy, or just how effective it can be. There are many reasons an adult may begin speech therapy, and the good news is that it's never too late to start. Some adults receive speech therapy to work on communication issues that began in childhood but were never properly treated. Examples might include a stutter or problems articulating certain sounds, like the S or R sound. Some adults receive speech therapy to treat speech and language problems that develop due to illness or injury, such as a stroke, traumatic brain injury, Parkinson's disease, cerebral palsy, muscular dystrophy, or ALS. Speech therapy can also help people struggling with communication due to a clinical diagnosis such as aphasia, acquired apraxia of speech, dysarthria, and other cognitive conditions. Speech therapy can help people who want to modify their accents or change the pitch, intonation, or quality of their voice. And finally, many adults seek speech therapy to improve their confidence and communication abilities in the workplace. Therapy can help with public speaking, interviewing, and interacting with colleagues. So, as you can see, there are lots of reasons an adult may need help with their speech and language. If you or a loved one could benefit from speech therapy, it's best not to wait. The sooner a person begins therapy, the sooner they can begin making progress. You may be wondering how exactly speech therapy works. What does a speech therapist do? What do sessions look like? Therapy is provided by a trained speech-language pathologist, also known as a speech therapist. All practicing speech therapists are licensed in their state and nationally through the American Speech-Language Hearing Association. First, the speech therapist will perform a comprehensive evaluation and review your concerns. Once this assessment is complete, the therapist will create a treatment plan individualized for your unique situation and needs. This treatment plan will include specific goals so that the speech therapist can observe and track your progress during therapy sessions. After the evaluation, the speech therapist will decide on frequency of therapy sessions. Most people attend sessions weekly, although this can vary due to the diagnosis. Speech therapy sessions are focused on each client's care plan, and the activities done during sessions always relate to those goals. So, for example, if a client is in speech therapy to better pronounce the S sound, they'll begin by learning that sound by itself and work all the way up to practicing it in conversation. Or if a client wants to improve the quality of their voice, the speech therapist will teach them appropriate vocal exercises. No matter the goal, the therapist will aim to do as many trials of each exercise as possible in order to make the most of each session. Your speech therapist will constantly be measuring and assessing your response to these exercises. When needed, they'll make changes to your treatment plan to help you make progress as quickly as possible. One question I frequently hear from clients is, how long does speech therapy take? I wish I had one easy answer, but it's not so straightforward. The length of therapy differs from person to person for several reasons. One is the severity of a person's communication deficit. Someone who needs to work on 1 or 2 speech sounds may complete therapy more quickly than someone who's had a severe stroke affecting their communication abilities. Even people with the same diagnosis may vary in the amount of time they're in speech therapy. This can be related to their individual responsiveness to therapy. It can also be due to how often they practice outside of therapy sessions. In order to make the most progress as quickly as possible, people have to practice their communication skills outside of their sessions. Practicing regularly helps reinforce what was taught in therapy so you can start each session in a strong place and continue to progress. Similarly, the more consistently a person attends speech therapy, the faster they'll make progress. Missed sessions can really add up over time, especially if you're only meeting once a week. Your speech therapist wants to provide you with the best possible care, and consistent meetings are needed for this. Speech therapy can be truly transformative, and adults should never worry that it's too late to start therapy. The phrase "better late than never" absolutely applies here. So, if you or someone you love is considering speech therapy, don't wait. Begin your search for a speech therapist so you can schedule an evaluation. We all deserve to be able to communicate clearly, and speech therapy can help you do just that, no matter what age you are.